Okay, this Naplex practice question is giving you an abstract of a study, and it's always standardized in this type of way. So the background, and then have methods, results, conclusion, and then there'll be a question on the side of the monitor. So the question, you should go straight to the question. Ignore everything right away. So the question asks, from the abstract above, what is the number needed to treat with Apixaban compared to warfarin to prevent one instance of the primary outcome? So the question is asking about number needed to treat. It's also abbreviated NNT. So right when you see this, you just have to look at the results. Go straight to the results and see what calculation we need to do. So they want to know about the primary outcome. So just quickly skim over to try to find the word primary outcome. It's usually on the first line of the results, because then after that it's usually a bunch of secondary outcomes. In the case of this results, if you were to read it all, there's actually 4 more secondary outcomes which are totally irrelevant for this question in particular, because this question is only asking about the primary outcome. So we have the primary outcome right here, and they're asking for a number needed to treat. So the formula for number needed to treat is 1 divided by the absolute risk reduction. And the absolute risk reduction is also the control event rate minus the experimental event rate. So it's basically one result minus the other result, especially in this question because there's not really a control group, because we're comparing 2 different groups. We got a Apixaban group and a warfarin group. So we just need to find the results. So they have here the primary outcome was 1.28% in the Apixaban group. So that's one of the results that we need here in this equation. So I'm just going to fill this in. 1 divided by the control event rate is going to be here 1.60%, because just find the larger number, because this has to be the denominator will have to be a positive number in this case. So 1.60% minus the smaller result, which in this case is 1.28%. Make sure you realize these are percentages. So this is also written as 0.0160, and this is 0.0128 when you do your calculation in your calculator. So when you solve for this, 1 divided by the quantity 0.0160 minus 0.0128, you'll get 312.5. That's the number needed to treat. So in biostatistics, you always round the number up to the nearest whole number. So the answer in this case is 313 is what you're going to be entering in the computer. And make sure you realize when I say round up, 312.5, if the answer is 312.1, or 312.2, or maybe something even smaller like 312.01, you're still going to round up to the nearest whole number. So all these 312.01, 312.1, 312.2, all of these would still be, the answer would be 313, because you go up, because you want to be cautious when you solve for this number needed to treat in biostatistics. That's why the answer will always be rounded up, regardless of whatever the decimal place is. You round up the number. So that's why 312 point whatever turns into 313. And that's your answer. If you have any questions, please leave it in the comments. I used to teach biostatistics in college, and I'm just trying to give you the fastest way to solve this question without knowing basic definitions like ARR, which is absolute risk reduction, or CER, which is control event rate, or EER, which is experimental event rate. All you had to do is just memorize it's 1 divided by the bigger result minus the smaller result, and then solve for that in your calculator, and you should have the correct answer. That's the quickest way if you're not really good in biostatistics. So if you have any questions, please leave it in the comments. I might do a video giving a more like instructive way how to solve it, but it's obviously the longer way. So if you have any questions, please leave it in the comments. Bye.